I would like to greet our Vice Chairperson of Academic Affairs. There is Ibu Eni here. Good morning, Ibu Eni. And then we would like to greet Pak Yarwin as Vice Director 3 for Student Affairs. And also, we would like to say good morning, Ibu Ria, that has joined in this Zoom meeting as the Vice Director 2 for facilities and infrastructure. And all our beloved lecturers, all specifically for all the beloved committee, all the organizing committees that has shown all big efforts for conducting this international conference. We would like to greet all the participants, especially for the lecturers also that has joined and registers for the oral presentation in this day one. Well, Bapak Ibu, I hope you are ready. After the presentations of the speakers, we are going to hold also the oral presentation in this day one.
Iya, ya Pan. Saya bangun belum Pan. Saya
And everyone, we would like to greet for this special someone here that who has joined in this section. There is the chairperson of Sekolah Tinggi Rumah Sakit Husada, Bu Elinia, SAMM. We would like to say thank you for joining in this today's section.
Good morning, ladies and gentlemen, distinguished guests, honorable speakers who are the experts in this field from around the world, respected colleagues, and all participants joining us from different universities and institutions around the world. Welcome to the second Sekolah Tinggi Ilmu Kesehatan Rumah Sakit Husada International Conference with the theme Global Health Issues for Healthcare Transformation in Society, which will highlight 5 important subtopics. First, integration of palliative care. Second, geriatric health in an era of global aging, challenge, and transformation. Third, excellent service in health transformations, the key to public trust. Fourth, health education and innovation. And last, health and sustainability policy. My name is Fitri Adela, and I will lead today's conference until the end. This conference will be held for 2 days. We sincerely hope that all participants will actively engage and take part in both days of the conference. Before we officially begin, we'd love to see our wonderful participants. May I kindly remind everyone to please turn on your cameras, give us a wave or thumbs up reaction if you are excited. It helps us feel a bit more connected even across the screens. We also remind all participants to keep your microphone on mute during the session unless you are invited to speak by the moderator. Demi menjaga ketertiban dan kelancaran acara, kami mohon kepada seluruh peserta untuk aktifkan kamera selama acara berlangsung, serta memastikan agar mikrofon tetap dalam keadaan mute, kecuali saat diberikan kesempatan untuk berbicara atau bertanya oleh moderator. Terima kasih atas kerjasama dan perhatiannya. On behalf of the organizing committee, I would like to extend our deepest gratitude to our keynote speakers, panelists, moderators, and participants who made time to join this conference. Without your contribution, today would not have been possible. Okay, as we begin this international conference, let us first honor our beloved country. Ladies and gentlemen, once again, please turn on your cameras as we sing together our national anthem, Indonesia Raya.
Bangsa tirai damai, angkat semuanya, dunia.
Next, we will hear a report from the head of the organizing committee. Please welcome Nurse Rizka Wahdini, Magister Keperawatan, who will deliver the report on behalf of the organizing team. Nurse Rizka, the time is yours. Thank you so much, Nurse Rizka. So, to officially open today's program, it is my honor to invite Miss Elinia, Sarjana Ekonomi, Magister Manajemen, to deliver the opening remarks. Please give a warm round of applause to Miss Elinia. Miss Elinia, the time is yours.
Pada tubuh tersebut, bahwa kegiatan pelaksana pengawas terdapat untuk semua. Saya bertanya, what today we will try to reflect our effort untuk more perhaps and stay as best in a particular. Saya everybody to take in a particular let's start today in here. And then congratulations for together. As Konferensi Internasional Conference, this is first album seminar that will open tomorrow. The national conference. This event provides an opportunity for activities and published in the Biological Journal. Thus, Iceland Indonesia to in our time for Thailand. It is certified to return to the International Conference. Thank you to the entire committee for this event. Regarding the future, the better, let's suggest and the Philippines. And the other speaker from Indonesia, Miss Amy, from Speakers FS Lusada. Thank you for participants and thank you for today. And we have already starting the seminar conference right now until tomorrow. Thank you and God bless you.
Thank you, Miss Elinia, for the opening remarks. Ladies and gentlemen, we are now moving forward to our keynote session. This is a special moment where we gain insight from one of the most respected figures in the field. This session will offer many valuable benefits for all participants, including expanding global knowledge and perspective, developing professional skills and competencies, improving English skill, building wider professional network, gaining motivation and inspiration, and of course, you will get an international certificate and recognition. This session will be guided by our moderator, Miss Linauli Happy Christina Zega, Magister Pendidikan. Without further ado, please give a big virtual round of applause to welcome Miss Lina. Miss Lina, the session is yours.
Well, thank you, Fitri Adela, for warming greetings for me. I would like to say once again, good morning, ladies and gentlemen. How are you doing today? I hope everyone is feeling energized and excited because this session is going to be full of inspirations and insights, of course. My name is Linauli Happy Christina Jega, and I'll be your moderator in the session of the second Sekolah Tinggi Ilmu Kesehatan RS Husada International Conference. It's truly my pleasure to guide you through the session on global health issues for healthcare transformation in society. Now, let me ask you, how many of you are attending this conference for the very first time? Can you raise your hand on your screen? Yes, you may. Raise your hand on your screen. I would like to see how many of you, all the participants, that attending this conference for the very first time. Yes, anyone? Okay. All right. Yes. Welcome to the family, all the participants. Wow, great, wonderful. All right. Thank you for this response. I'd like to say, yeah, welcome to the family. And for those who returning participants, thank you for coming back. It means we do something right in this section. Today we are very fortunate to have amazing speakers with us. Allow me to introduce them briefly. Our first speaker is Ibu Yulisna Mutiasari SSTFT MSc GNR Stat PhD, who is specializing in rehabilitation, aging, and independent living. Then we have Ibu Yayu Mukarohma Asos, MKM, a public health specialist who will share valuable perspectives with us, of course. And the last but certainly not the least, in this day one, we have also Miss Wongko Wongcherian, PhD, MS and RN, a highly experienced nurse educator and researcher from Naresuan University, Thailand. Each of them will have around 30 minutes to present, and afterwards we'll have a Q&A session plus documentation in 10 minutes. Well, once again, ladies and gentlemen, distinguished guests and fellow participants, it is a great honor for me to introduce our distinguished speaker for the first session. Ibu Yulisna Mutiasari, SSTFT, MSc, GNR, Stat, PhD. Let me show you our first speaker curriculum vitae. Ibu Yulisna Mutiasari, SSTFT, MSc, Gerontology and Rehabilitation Studies, PhD, is an assistant professor at Monash University, Indonesia. Dr. Yulisna holds a Doctor of Philosophy in Physiotherapy from Monash University, Australia, specializing in rehabilitation, aging, and independent living. She also earned a Master of Science in Gerontology and Rehabilitation Studies for the University of Wollongong and a Bachelor of Applied Science in Physiotherapy from Universitas Muhammadiyah Surakarta, Indonesia. Wow, great, Ibu. Her academic and professional expertise lies in gerontology, geriatric physiotherapy, aging dementia, and older people rehabilitation. Dr. Yulisna currently serves as an assistant professor of research in the public health program at Monash University, Indonesia, and as an adjunct research fellow at the Rehabilitation, Aging, and Independent Living Research Center, Monash University, Australia. In addition, she is the head coordinator of the research division at Alzheimer's Indonesia, where she leads numerous initiatives focused on dementia care, aging, and health promotion for older adults. Let me continue. Dr. Yulisna has published extensively in international journals with her research exploring telehealth, based rehabilitation, dementia-friendly exercise programs, and the empowerment of older people. Her outstanding academic contributions have earned her multiple awards. Let me tell you, everyone, including the Best PhD Thesis Award 2024 and several distinctions for research and innovation during her doctoral journey at Monash University. Wow, great, Ibu. She has presented her work at leading international conferences such as the World Physiotherapy Asia Western Pacific Conference, the International Association of Gerontology and Geriatric Congress, and the last important thing, the Global Alzheimer's Disease International Conference. Her research continues to strengthen global collaborations in aging and dementia studies, particularly in advancing rehabilitation and telehealth services in Indonesia and beyond. Ladies and gentlemen, please join me in welcoming our distinguished speaker, Dr. Yulisna Mutiasari, who will talk about the role of technology in elderly care in physiotherapy physio services. Give applause for Ibu Dr. Yulisna Mutiasari.
Hello, hello, good morning. Thank you so much, Ibu Lina. So wonderful introduction and very honored that I can be the speaker of this wonderful conference, international conference for sure. And also would like to appreciate all of the committee and also from the head of the Stikers Rumah Sakit Husada and all of the participants that come in today. Because of the time, I think I just would like to just share my screen. Okay.
Don't hesitate to tell me if you need any assistance, Ibu Yulisna Mutiasari.
Okay, thank you so much. Okay, I just use this one and yep. Okay. Okay, do you see my screen now?
Yes, we can, Ibu.
Okay. All right. Okay. Hopefully everyone having like a good morning and shining and good like sunshine. I think everyone, most of us in Indonesia and also from Asia, I can see from the wonderful speakers in the list of this international conference. Once again, thank you, Stikers Rumah Sakit Husada, for holding such a wonderful conference, and hopefully it will bring something like shed the lights and bring a knowledge from and can sharing each other and can learn from each other. Okay, today I got the responsibility to get an honor to present about the a topic that quite like current, especially for us in the Asia and also around the world, is about the technology. So I would like to share about the role of technology in older people care in physiotherapy services. So I start with the physiotherapy geriatric things as one of my expertise. That I would like to start with the background that the world's population now is aging very rapidly. By 2050, the projection from the United Nations indicate that 1 in 4 people in Europe and North America will be 60 years or older. So these shifts represent unprecedented demographic changes that will reshape healthcare demands globally. And also if we see in the Southeast Asia or like in the Pacific region. So I would like to say one of the critical concern for this demographic is the high incidence of falls among older people. So research shows that 28 to 42% of all adults aged 65 and older experience falls annually. So these incidents often lead to serious injuries, significantly impacting their quality of life and increasing the burden on healthcare systems. And another major issue that I will connect with what we are talking about right now is the access barriers to healthcare. So people can't really get the access to the healthcare that they really need, especially for older people. So traditional physiotherapy, for example, faces significant challenges in addressing the needs of older adults. So the example like mobility limitations, geographic distance, and individualized care requirement can hinder the access to the necessary services. And also, if we talk about Indonesia and other country in Asia, we are a country of the so many islands, and sometimes there is like inequality of the healthcare services. So the quality is different. Like if we say like in Java and also like in Eastern Indonesia, there's the differences of the quality, and it can hinder if people in the Eastern Indonesia would like to get the good access of healthcare, they need to go to the big city. Or if Indonesia, sometimes people go to Singapore or Malaysia to get like the access of the healthcare. So in this slide also, we can see a visual representation of how various countries' population aged 65 years and older are projected to change over time. So this chart illustrates the difference of demographic transitions. So if we say like Japan and France, which have already seen a significant rise in their older populations. So by 2050, we expect this trend to continue with countries like Indonesia, Vietnam, and Thailand. If we see there is only like 20 years, this country will go from the young aging population country to age population country, which the population of older people is more than 14% of the population. So if we go to Indonesia and other developing countries are undergoing a rapid transition from a moderately aging population to an aged population country only within around 15 years old until 25 years old. So this demographic shift brings several implications for healthcare, social services, and also economic structures. So countries with rapid aging population will need to adapt so their policies and services to cater the needs of older adults effectively. And then we go to how the policy or how the technique, how we cope with that, such of the problem. So one of them is technology. So we talk about technology in physiotherapy. We can say that technology can transforming the care delivery. So as the topic of our today's discussion was, what is the role of technology in older people care in physiotherapy services? So if we delve into how technology, particularly if we talk about telehealth, for instance, is transforming care delivery in physiotherapy. So it started when the COVID-19 pandemic significantly accelerated the adoption of technology in physiotherapy. With in-person visits is limited, so we can't see the physiotherapy, we can't see the doctor because of the physical distances. So healthcare providers turn to digital solution to continue offering care. So this shifts has not only maintained continuity of services, but has also highlighted the importance of technology in modern healthcare. So telephysiotherapy, we call it if we go to the physiotherapy services. So a rapidly growing branch of telehealth is like revolutionizing the way physiotherapy services are delivered. So it offers an innovative solution that enables patients to receive quality of care from a distance. So we don't need to go to that physiotherapy clinic or physiotherapy or going to the hospital to exactly see the physiotherapist. So this approach is particularly beneficial, especially for older people, allowing them to access necessary treatments without the barriers of travels or also the mobility issue. So now let's explore how technology is revolutionizing the delivery of physiotherapy for older adults. So it can address several challenges. The first is the personalized care. So evidence shows that technology enables personalized care. With advanced tools, healthcare professionals can create precise and also individual treatment plan adapted to each patient's unique needs and also the progress. So this customization ensures the older adults receive the most effective interventions for their specific conditions. The second of all, we have remote monitoring capabilities that can efficiency of care, but also provides convenience for seniors who may have mobility problem or mobility issues or live or live in the remote areas. And lastly, it can enhance the access. So for seniors or for older people facing mobility constraint or living geographically isolated locations like in the remote area or in the village, telehealth solution provides vital access to physiotherapy services. So this addresses significant barriers, ensuring that older adults can receive the support that they need. So this slide like captured my experience when I work in a nursing home in Australia. So it showcased essential aspect of my role in providing physiotherapy during a challenging time. So we prioritizing safety with personal protective equipment when COVID-19, and then engage the residents through activities to foster community. And also we utilize the technology during delivering the care for older adults in the nursing home or aged care residence. Okay, if we talk about technology, what kind of technology that we are talking about that can beneficial for older people? So I give some of the examples of the technology that used in the gerontology or the geriatric physiotherapy. So some of them is the wearable devices. So it's about the tracking and enhancing the mobility. So this kind of technology can beneficial the older people with helping them or assist them in doing the mobility, moving from other place to another place. So the first one is real-time biometric data. So skin lifts like smartwatches and embed sensor continuously collect biometric information from daily activities in the real world. So this kind of technology can, having like the sensor that can help with older people how they movement, how they do some of the having like the coordination problem, some of the like a balance problem, something like that. And they're also like remote progress monitoring. So therapists can remotely monitor patient progress and adjust treatment plans in real time based on objective data. And the another one is like quite emerging at the moment because we know that falls is like a big problem for older people. So fall detection and safety. So specialized fall detection devices alert caregivers immediately when a fall occurs. So we know that older people can like doing like independently mobile, but when something like emergency, like when, for instance, like when they fall, so the caregivers or the healthcare professional or the nurses can know immediately that something happened with the older people. So with that, so we can reducing injury risk and also response time. So we can respond the fall immediately. So another thing about technology that emerging for geriatric and gerontology space is virtual reality and XR gaming. So when we heard about the XR gaming or like virtual reality, we're thinking about young people or kids or like adults like playing the virtual reality, becoming like emerging things for fun. But actually, virtual reality and XR gaming. So XR gaming is exercise gaming. So they play gaming, but actually they do the exercise. So we can engage the balance and also mobility training with doing that. So virtual reality and XR gaming technologies combine entertainment with therapeutic exercise, making rehabilitation more engaging and effective. And also, we can touch the recreation thing. So older people also can having fun with doing the exercise, not like they have to do the exercise, but also they want to do the exercise because it's really fun, and also can create the bonding with the caregiver, with the family, with the spouse, and also with the physiotherapist itself. So the clinical effectiveness, so VR or virtual reality extra gaming with motion capture improve functional mobility as effectively as conventional exercises with statistical significance in several studies. And also augmented feedback through visual and tactile stimuli enhance motor learning and movement quality. So there's some of the quite already many studies that testing that, and it shows that good significant effect that increase the balance and also mobility. Is also safe, and also like additional benefit that it can enhance their mental health, like having fun, increase the mood, and also create the bonding with the caregivers. Okay, what are the technology that we're talking about? So we talk also about the smart assistive devices and home care robots. Who it looks like very fascinating, and also if we talk about robot, so it's actually already developed, especially in developed countries like Japan, Australia, US, something like that. So like smart walkers. So advanced walkers equipped with sensors provide stability support and deliver real-time posture feedback to prevent falls and improve gait quality. And also care robots. So care robots is quite like developed now in the gerontology. So if we talk about older people gerontology, and if it relates to the technology, so we call it like gerontology. So the care robots are already developed, like robotic assistants help with activities of daily living, medication reminders, and social interaction, reducing the caregiver burdens. The other thing is independence and safety. So this device enhance independence and safety while supporting aging in place, so allowing older people to maintain autonomy and also the dignity. And other examples about the future trends and innovation. So the VR is keep developed, and wearable sensor, the blended care models. So the blended care model is an increased adoption of hybrid approaches that strategically combine in-person session with remote care for optimized outcome. So like telehealth, from my previous study, the older people and the caregiver don't want to do like the total telehealth, so we try to combine like we call it hybrid. So they still seeing the physiotherapists, but not as many as like 3 times or once a week, but the physiotherapist can visit them, or they can go to the physiotherapist in the first time of the session, and after that they can do that at home, and physiotherapists can monitor remotely. And also the personalized program that leveraging data from various resources to create highly individualized and adaptive physiotherapy program for patients. Okay, so from that, so I would like to share one of my research that I have been doing, and I have published in one of the journal. I can give the link of the journal, so about the telehealth. So what is telehealth and telephysiotherapy? So telehealth is the use of digital technology to provide remote healthcare services. And telephysiotherapy is more focused on specific application of telehealth in the field of physiotherapy. So it involves virtual physiotherapy sessions conducted using technology such as video calls, specialized mobile apps, and digital devices. So the patients can receive guidance, evaluations, and exercise program without needing to be in a clinic. So there are several telehealth models and also technologies. So telehealth leverage a variety of models and technologies to deliver physiotherapy services effectively. The first model is synchronous. So the synchronous models is like a real-time video consultation. So we having like appointment, or like we have appointment with the patients and the physiotherapist. So it's live interactive sessions using platform like Zooms or Microsoft Teams, or like Google Meets or something like that, allowing for immediate feedback and dynamic assessment. So that's called real-time video consultation. And the second one is live assessment. So therapists guide patients through movement and observe responses in real time to assess function and also the progress. The second model is asynchronous model. So asynchronous, they don't in the live interactive session. So it can store and forward. So patients record videos of exercises or symptoms and securely send them for later review by the physiotherapist. So it is ideal for monitoring the progress. And the second one is the remote patient monitoring. So utilize wearable devices like smartwatches, activity trackers, and dedicated apps to collect continuous data on patient activity like sleep. So how's the patient's sleep pattern, how the adherence of the exercise program on like vital signs, and providing therapists with objective insights. So this kind of the two kind of the models, so synchronous and also the asynchronous model. So this is the evidence from the research about uh, the effectiveness of the telehealth. So I'll just give you one example here in musculoskeletal physiotherapy. So growing evidence supports the effectiveness of telehealth in managing a wide range of musculoskeletal conditions, demonstrating the comparable outcomes to traditional in-person care in many instances. So how about the effectiveness? So telehealth is proven effective for common musculoskeletal issues like low back pain, knee osteoarthritis, and shoulder impingement. And how about the patient satisfaction? So study shows that patient satisfaction with telehealth physiotherapy is often comparable to or even higher than the face-to-face consultations. And we also get the benefit of the saving the cost. So demonstrate the cost saving, especially in post-operative rehabilitation programs for procedures like knee arthroplasty and due to reduced travel and also clinic overhead. And the guideline adherence, so telehealth facilitates the delivery of guideline-based, so individualized exercise program and comprehensive patient education. So it's also crucial or is really important for long-term recovery. So with the telehealth, it shows that physiotherapists can adhere the guidelines, so they can having like the guideline in which kind of step or which stage they need to do something. So it really help in to follow the guideline of the one of the case of that they treat. Okay. So can physio via telehealth really help? So I can't. Okay, this some of the statements that I summarize from some of the evidence. So using telehealth can help people access support from a physiotherapist to help them manage their health. Telehealth can be as effective as conventional healthcare methods to improve physical function. As the expert in movement, physiotherapists can guide people in how exercise can help recovery. So while the evidence saying that, okay, telehealth is just the same, have some effect with the face-to-face, but there's still need like the precautions, there still need the conditions, or they still need the requirements that need to take into account of the physiotherapy. So not all of the cases can be treated using telehealth, of course. But in the common cases that not really like emergency or they don't need to hands-on or physiotherapy, the telehealth can help. And sorry, the physiotherapist should use their professional judgment to make decisions about the most appropriate consultation method on an individual basis. Okay, this kind of telehealth or telephysiotherapy, there's three kinds of them, which is telemonitoring, like the process of data transmission about patients' physiological status. So telemonitoring is really about how physiotherapy can monitor people or can monitor the patients from the home to the healthcare provider. So it can use like like I mentioned before, like smartwatches or like the apps that can track their like the vital sign, can track how they adhere they exercise, so they can put okay, today I do the exercise and tomorrow I don't, something like that. So physiotherapists can monitor whether they really follow or adherence the exercise itself. The second one is telecoaching. So telecoaching can be used to provide in-home support for advice via motivational text message. So like giving like motivational or giving like the coaching using the technology. And the third one, that the one that commonly do in physiotherapy space, like telerehabilitation. So the delivery of rehabilitation services at the distance via telecommunication technology, like I mentioned, using the Zoom or the video call, and then physiotherapy sitting in the clinic and then monitor and also giving instruction on patient how to do the exercise program. Okay, this is the growing evidence how the telehealth or telephysiotherapy can giving the benefits for older people especially. And also just give, this is since 2020 really, when it was COVID-19. So the World Physiotherapy giving advice that telehealth can be used for rehabilitation. And physiotherapists are using telehealth to support patients and treat wide range of conditions during the COVID-19. So they also like recommend that telehealth can be as effective as conventional methods of healthcare delivery. And this is the kind of the condition that can be treated using telehealth, like chronic obstructive pulmonary disease, chronic heart failure, type 2 diabetes, traumatic disease, mental health condition, musculoskeletal conditions, cancer, and post surgery. Okay. Okay, this is the benefits. So I think I just like skip this. And this one, this is from the evidence saying that 82% telehealth can reduce travel up to 82%. So physiotherapists report significant reduction in patient travel time and associated costs. It's really important, especially for older people when having like mobility issue, so they can't go to the clinic, but so the telehealth can help them so they can get the treatment at home without going to the or having like a travel. It's also having benefit in the cost, so they don't pay for the gasoline or don't pay to the, like taxi or something like that. And also flexible scheduling. So 81% improved scheduling flexibility benefit both patient and also the providers, and minimize infection risks and up to 92%. It's also crucial during the pandemic, of course, and also the increase the access. So telehealth bridge geographical gaps, enhancing access specialized care for those in rural and also underserved regions. And then how to prepare for a virtual assessment. So that's kind of the poster that I give to having like how to prepare, like how to set the environment to do the telehealth, like quiet environment, of course, technology check, adequate lighting, appropriate clothing if you want to show the patients, and also you give the advice or education the patient to wearing the appropriate clothes and like comfortable enough to do the exercise, something that you're doing for, and also proper setup your devices and camera angle. So it's like a technology practical preparation. And this one, I just show you evidence to guide telehealth physiotherapy. So Pedro, guideline in telehealth physiotherapy have published. So it's like open access. You can like freely download the studies. So this is a study related to telehealth. So you just click this link or just like Google like Pedro telehealth physiotherapy is coming to this one. So like this one, this study about telerehabilitation services for stroke, alternative model of cardiac rehabilitation, and telehealth care in COPD, something like that. So you can see how the practicality and how the effectiveness of the telehealth in each of the case. Okay, despite of the benefits that I mentioned, this like huge of benefits of telehealth, but we still having like facing the challenges in telephysiotherapy implementation. So the first one, with telehealth, of course, there is a limitation of physical examination. Really, we can't do the balance assessment, or we can't do the test, or we can't do the stretching, okay, because we can't really touch the patients, or we can't do the manipulation therapy, so we can't do that. So that's the limitation. So difficult to perform a manual physical assessment remotely. And also internet connectivity can be a problem. Okay, so sometimes the signal gone, or the Wi-Fi shut off, or something like that. So that's the problem. And also the technology literacy. And also research shows that older people having a low literacy of technology, so they don't really use, they don't really know about the technology. So it needs someone like the caregiver or the family helping them as the solution. So not all patients have access to reliable internet or possess the necessary technological skills, like my dad or my mom, they can't really use the new phones. They still keep using the previous phone that they get used to use. If we change the phone, they will having difficulty to learn new things. And also the patient compliance. So some patients may face challenges in motivation and adherence to the treatment plan and the regulation and insurance policy. So lack of clear policy may limit access to necessary services. Okay, so how about the solution and development recommendation? So we can use hybrid model that I mentioned, using telehealth, but also need to see the patient, because we need to really doing the physical assessment with the patient, and also the technical training, use-friendly application development. So not really, the application that really difficult to use, and also the regulatory support. So how government, how the health services, policymaker integrate the technology things to the policy service. Okay, so this is just share one of my study that I did on 2023. So a telehealth home-based exercise program for community dwelling older people with dementia in Indonesia. So this study really explore how older people with dementia in Indonesia participating in the exercise program that I created. So this is the theme of my research from Australia. So this is when I delivered the telehealth program with the older people with dementia. So I already shared in the conference, the international conference in Australia and in Japan. So if you want, or you're curious what kind of intervention that I deliver, so this was individualized remotely delivered exercise based on Otego exercise program. So with some of additional modification, with care supervision, 5 times a week, 20 until 30 minutes per session, and for 12 weeks. And what the physiotherapist's role on that? So physiotherapy is providing orientation session, visiting participants online 5 times during trial, selecting the exercise, and also modify the exercise to address participant needs, function and mobility level, monitor and modify the exercise program, answer any questions in each visit, and having full follow-up or super session during the intervention period. And this is the result. So in this study, older people with dementia and their carers were recruited from 2 locations across 12-week intervention periods, and also having 6-week follow-up. So the key finding was the retention rate for participant was 84.1% during the 12-week intervention and 70% during the self-maintenance period. And we found also no serious adverse event like falls, which is really good, that because this exercise program can be continue for the next trial because it's safe. There is no adverse event, no falls happen. And the conclusion, while some aspect of function and disability were affected, the telehealth related benefits also may improve enjoyment and quality of life for older people with dementia in Indonesia. Sorry. So additionally, the structured exercise program is deemed feasible and also safe, highlighting the need for continuous effort to enhance long-term adherence to the program. All right. And then there's another study that we did in my team. So we did like qualitative research. So we interviewed the people with dementia and the carers. How was that? So what's happening? What's your experience with the exercise? So it's really about the qualitative data that the people with dementia and the caregivers giving the story, how was their experience with the exercise using the telehealth program. So this study provides a rich qualitative data on the experience and perceptions of the older people. So this is the generated team. So if you're interested, you can go to this link to see like the full paper from this journal that I published. So there are the generated teams like motivating factors to participate. So people with dementia saying that, most of them saying that I joined the exercise program because my family asked me to do that. So really the family is the key people to really support how the exercise program can be successfully happen. And then some of the benefits for people with dementia, you can see from the paper if you're interested too. Because of the times, I just go through it. And then there are some impact of the carer, challenges and enablers to exercise, carer strategies for exercise engagement, because, really challenging to engage the people with dementia with having like not really good mood every day, like having like up and down mood. Sometimes they want to do exercise, sometimes they being like not really mood to do that. And also roles, relationship and support and participant receptiveness to online delivery, the exercise program. So this is the study conclusion. So that online deliver exercise program was acceptable. So for people with dementia and the carers in Indonesia, and also they reinforced the importance of carer support in the exercise program, and also it highlights some challenges and enablers in undertaking exercise for people with dementia and the carer via this method. So the recommendation is future studies might consider using hybrid format that I'm doing right now. So I'm still doing the data collection and would like to do the analysis when the data can be collected. So the conclusion, embracing technology for better adult care. So in summary, integrating the technology into older adult care is essential for improving outcomes, but also with some highlight or some precaution that physiotherapists need to put into account that not all of the condition or not the cases can do by the telehealth. There's some action that need to do, like ensure that healthcare professionals are actively involved in the development and implementation of technological tools, and also invest in training, and also focus on human-centered design. Okay, so not really about the machine or like the robot things, but really focus on design that are intuitive and accessible and catering specifically to the needs of older adults, and encourage the interdisciplinary collaboration. Okay, thank you. I think that's the end of my presentation, and I will bring back the time to the moderator, Bulina. Thank you so much.
Thank you, Ibu Yulis Namutyasari. That was not only informative but also very inspiring presentation, Ibu. I could see many of the participants nodding and taking notes. That's always a good sign, participants. Ladies and gentlemen, now it's your turn. We would like to hear from you. If you have a question, please raise your hand and deliver your question, but make sure your microphone is unmuted. The screen is yours now. You may deliver one, two questions. While we are waiting for the questions from the participants, Ibu Yulis Namutyasari, could you let me to give a question, please?
Yeah, sure. Thank you.
Yes, after hearing from you, so wonderful presentation that focus on technology, transforming care delivery specifically for the older people. We have talked about the kind of technologies, the beneficial thing, and the long terms, and rather than the short terms. I would like to talk about how about the ethics. I mean the privacy and the data protection that can be make sure by using this application or this technology. Can we protect our personal data by using this application, Ibu?
Of course, I mean, like, using the technology, when we develop such of the technology, data protection, confidentiality is kind of like really crucial things that need to be, take into as a priority in using the technology. So when we start with the research, of course, we need to maintain the confidentiality, data protection, like data security, something like that. And also in the implementation of the technology, the developer also need to really adhere all of the requirement of data protection and also data security to make the data still in the secure, like, in the database, or that they having like the really good protection to make it still secure. Thank you. That's a good question, Bulina.
Okay, thank you, Ibu. I have a question more from the participants. The question is this technology already available in Indonesia, particularly for monitoring elderly people in the community? And with collaboration techniques can be implemented with the provisions in the community?
Okay. Sorry, probably what kind of technology? If like the telerehabilitation, like using telehealth, you need to like adhere the guidelines. So the one that I did in my research is like simply using a Zoom to having like, appointment with your patients, and then you deliver the exercise program and following all of the recommendation or guideline. Like for instance, like you will give like a training session to the participants and the caregivers. So the requirement is when you deliver exercise, especially for older people, there should be like the caregivers or the family next to them to make it safe. So safety is the first priority when you're doing the telehealth, especially with older people. So there should be someone that really sitting or standing next to the patients to make sure that when there is like some movement, if the patient like, they're having like a balance problem, so the patient, so the caregivers or the family will be ready to like catch them, something like that. So there should be caregivers there. And also, you need to say that for the first, especially for the first assessment and also first session of the exercise. So I always like ask the patients doing some of the movement, like especially the balance movement, like when you ask them to like, lifting your leg, something like that, to challenge the balance. It's always having like something to hold on, like a table or something like that, they stay steady to make sure that they don't fall, something like that. So always start the exercise from the lowest level, and then you can see how the patients, like react, or what the response of the patients with the exercise, and then you can like increase like, one by one of the steps, something like that. So there are some of the precaution and some of the things or requirements that we need to adhere for the telehealth. So so you can click the link of my study. There's like a protocol or the things that you can join. So that's for the telerehabilitation, because just like using Zoom, like us doing it now. But for the other technology, like like the robot, I don't think like in Indonesia we have that developed, but just in the developed countries. But we can go to that, like especially with the like interesting, like in the restaurant. I think some of the restaurant in Jakarta have like a robot, like sending using like a sensor and sending the food using the robot, something like that. And it's also can implement it like helping the older people to keep them like independently mobile, like helping them like using the sensor and having the safety in their own home, and they can like independently mobile in their own home. Some of the aged care homes in like the private aged care homes will start to want to use that, but of course, I mean, like the cost will be quite like, the cost for staying in that place will be affected with the price of the technology. I think that in virtual reality, I think we start to use that in the rehabilitation space, and like tracking, remote progress monitoring. I think everyone start using like a smartwatch to see how was my sleep, how was my, the vital sign, how was my, tension, something like that. So it depends. In Indonesia, some already implemented, but some, because of the technology and the price of the technology, probably we haven't really go for that. Yeah.
Yes, well, Ibu Yulisna, that's one of my perspective that this is the difference between human touch and digital touch.
Yeah.
Okay, would you like me to give you one more question, please, from the student of Stikas era Susada? Yes, please, Rifki Ardiansyah, you can unmute your microphone, please.
Okay, thank you, Miss. Good morning, ma'am. Beforehand, allow me to introduce myself. My name is Rifki Ardiansyah, a student in the Bachelor of Nursing program. I want to ask about something. You dominantly explain from the perspective of physiotherapy, the future physiotherapy. And incidentally, I am a nursing student. So, you briefly touch upon AI and robotic technology. So, what is your suggestion or advice in the rapid development of technology, and how should we prepare ourselves about preparedness ourselves as a future healthcare professional to face collaboration with technology in this digitalization era, especially from the perspective of Indonesian future? Because you mentioned earlier that you had experience working abroad, where you certainly would have collaborated with various other healthcare professionals. So thank you.
All right, thank you. So I think I just directly answered that, Bu Lina, if you don't mind. Okay, thank you, Mas Rizky, for the good questions. So really, yeah, we're living in the digital, really like digital modern era, using like digital technology, and we can't really deny it, or we can't really prefer, okay, I don't want to use that, because everything right now, you see, you go to the restaurant, okay, do you have this app? You can pay without this or something like that. So they like push us to using the technology. And in this era of health, especially in my expertise, gerontology and geriatric, to help older people. So as long as it will beneficial to helping older people, or helping patients, helping the health professionals to giving like the benefits of improving the quality of life and some of the benefits. So okay, we accept that, but really in the development of AI, I'm not a digital data science people. I'm from the health professional background, but I talk to my colleagues at Monash Indonesia, really like AI is developed really rapidly at the moment, but we also really need to be consider and be careful as well, because the AI can take the role of human, really, especially with your brain. If you use AI every time, it will like make your brain, okay, I don't want to think, like, okay, I have AI to like solve over the problem. Okay, so we can use that as a like helper for us, but not change our role as a human, something like that's the key point that I got from my friend, like a data scientist expert. And for the collaboration really. So I mentioned some about the collaboration, and really when I did my master at University of Wollongong, so Master of Science, Gerontology and Rehabilitation Studies, is not a physiotherapy based, it's a really multidisciplinary study. So I collaborate with nurse, with the doctor, with the social workers, even like really want to having the expertise in gerontology. So we need to work together, especially with the like monitoring, like I mentioned, telemonitoring, or like uh using like an app or the machine, something like that, to helping the older people. Really not only physiotherapists, but also the nurse, the the doctor also need to go into integrated in having like the collaboration using the technology to help with the older people. Hopefully that answered the questions, because I quite concerned with the time as well.
Yes, thank you, Ibu Yusna. But please, would you like me to give one more? Because this question is from physiotherapy lecturers of Stikas and Susada.
Okay,
Please, Ibu.
sure,
Yes, Ibu
sure.
Catherine, please, you can deliver your question. Yes, Ibu Catherine, the screen is yours. If you have any question, you can turn on your camera and then deliver your question. So in this seminar, all the lecturers from physiotherapy majors also join, Ibu. So
Oh, okay.
I'm sure
Really
that
nice to see you.
they would like to gain more many things from you, Ibu Yulisna.
Yeah, yeah.
Yes.
Hopefully we can see like face to
Mhm.
face.
Yes, Ibu Catherine. Is there any problem there?
Okay. Good morning, Ibu Yulisna.
Good morning, Bu Catherine.
Yeah, my name is Catherine Salim, and that was really inspiring. Thank you so much for the presentation. I
Thank
was
you.
wondering, considering the diversity in as related for condition, how can virtual reality programs be customized to address different level for physical ability, motivation, and also cognitive function among older people? And I just wondering what are the physiological and also psychological mechanism which virtual reality intervention can reduce fear of falling and also improve confidence in movement for elderly individuals. Thank you.
Okay, thank you so much, Bu Catherine. That's a really good question, especially with the virtual reality that I mentioned before, that usually like kids or like young adult or adult using that, and really some of the research evaluate the effectiveness, and it's surprising that the result of the research showing that there's like effective to for especially for older people having like a fear of fall, something like that. So with the virtual reality, so virtual reality that they see with the screen, like the picture, they see something, but I don't really having a try with that. So I just see like the paper of that and some videos, and with work of my colleagues in Australia, that they test the virtual reality. So with virtual reality, they're giving like some of the appearance or something like a video or movie, and then making them as if they can do the movement properly, like, so they see that, okay, I can do that. They see that so they're giving like a feedback, like a mirror exercise as well, part of that. Like if older people like exercise with the mirror, so they can see how the movement, the coordination, and giving like a real-time feedback. Okay, so the patient really can see, okay, this shoulder, I haven't really like giving the right movement, and then they try having that to be like the same with the left or right, something like that. And also giving the motivation, because the virtual reality, some of them like quite fun, but I don't know, but because I haven't really tried it, because they go to the some of the sort of the environment that make them like feeling relaxed. Like I just imagine probably like in the beach or in the mountain with the sounds of the thing that make them relax and make them like in the good mood to do something, and giving like psychological effect to the to the patient. And when they were asked to do the movement, they do it enjoyably, something like that. And also one of the result is about the bonding. So they do the virtual reality with their, like with the spouse or kids or their partner, something like that. It's also increase the bond, like having like a holiday together, but it's not they just stay at home, but having like the visual things that make them happy together with their loved ones also increase their, the hormone of happiness, like the endorphin, something like that. And also it can improve the effect of the exercise. I think so the combination giving like the benefits effect to the exercise itself. I hope that's make a sense.
Well, Ibu Catherine, I hope the answer from you, listener, can satisfy your curiosity.
Right. Thank you for the
Okay.
explanation, Ibu Yulisna.
Well,
Thank you so much for the question. So probably later we can have like, or you can send me an email or my phone so we can have a later discussion.
Oh, really, Ibu? Okay. Yes, all participants, you can list all your questions here to me or other committee that we can deliver it to Ibu Yulisna. Ibu Yulisna Mutiasari, this is a wonderful discussion with you in this morning session. We are so grateful. Thank you very much, Ibu Yulisna Mutiasari, for your insightful presentation and for answering all the questions. We have more questions that cannot be answered again. All right, we truly appreciate your time and valuable contributions to this session. Now, before we close, we would like to take a group photo together with our speaker, Ibu Yulisna Mutiasari, and all of the participants. May I kindly invite everyone to please turn on your camera and smile for the photo session. Our committee will capture the moment. Are you ready? All right, once again, please turn on your camera and then smile. Our committee will capture the moment. I will count on. Okay, we start now. 3, 2, 1, and smile. Okay. Yes, the committee has captured the moment. Okay, thank you. Thank you, Ibu Yulisna Mutyasari and everyone once again. Please give a warm round of applause for Ibu Yulisna Mutyasari, SSTFT, MSc, Gerontology and Rehabilitation Studies PhD for the wonderful session. Well, Ibu, you may leave this Zoom meeting, then yes, we can continue to the next speaker. Thank you, Ibu Yulisna.
Thank you so much. Thank you, everyone.
You're welcome, Ibu. All right, the participants, are you ready for the next discussion? I hope so. Well, we come to the second session, everyone. Ladies and gentlemen, we are now moving forward to our second outstanding speaker, Ibu Yayu Mukarohmah, ESOS MKM, who will talk about protecting and promoting child and adolescent health in the digital age. But let me show you our speaker CV for the very first thing. Well, everyone, it is my great honor to introduce our distinguished speaker, Ibu Yayu Mukarohmah, SSMKM. Ibu Mukarohmah is a public health specialist with more than 18 years of experience in development programs, particularly adolescent and school health. She holds a Master of Public Health in Health Promotion from the University of Indonesia and a bachelor's degree in social welfare from Pajajaran University. Wow, great, Ibu. Throughout her career, Ibu Mukarohmah has made significant contributions to national and international health initiatives. She has worked extensively with UNICEF Indonesia, the Ministry of Health, and the Ministry of Education. to design and implement major programs such as Sekolah Sehat and Aksi Bergizi, which promotes school and adolescent health across Indonesia. Currently, she serves as a technical expert at the Ministry of Education and national consultant for UNICEF Indonesia, focusing on adolescent health measurement and nutrition programs. Her expertise includes program management, advocacy, strategic communication, and policy development. In addition to her technical work, Ibu Mukarohmah has authored and contributed to numerous national guidelines, policy documents, and training models that strengthen Indonesia's school health system and youth health empowerment. Please join me in welcoming Ibu Yayu Mukarohmah SOS MKM, who will share her valuable insights and experiences with us today. Ibu Yayu, the screen is yours now.
Thank you, Ibu Lina Uli. Is my voice is clear, Bu?
This is so clear, Ibu Yayu.
Okay, thank you, Ibu Lina Uli, as a moderator that already introduced, give introduction, yeah, for this session. So good morning, everyone, all the participants. I'm very pleased this morning, that I can participate in the second international conference on global health issues for healthcare transformation at Stickers RS Husada, yeah. So like mentioned in the schedule, that I would like to share with you about the children and adolescent health, how we can protect and promote children and adolescent health in the digital age. On the last slide, I will also share with all the participants some examples that already promote in Indonesia by UNICEF Indonesia and the ministries to related to adolescent health, children and adolescent health, especially for menstruation, health menstruation, and also nutrition for adolescent health. Some example related to the digital health. But first of all, maybe allow me to deliver a presentation in Bahasa, Bu Lina Uli, and then perhaps later we can have more discussion about how we can work together, yeah, to address the health problems, especially for children and adolescent health. I will share the presentation, and then maybe on the last slide I will also play the video of the related to the digital health for adolescent health. So this is my presentation. Yeah. This is my presentation related to how we can protecting and promoting adolescent health in the digital age. Bapak dan Ibu and all the participants, we know that we face some problem related to children and adolescent health. Sorry. Can you?
Is everything going run well, Ibu?
Yes. Wait. Okay. Can you see my screen clearly, Mbak Lina Uli.
Yes, you can see your screen, Ibu.
Oke. So, Bapak and Ibu and all participant, so this is the background. Seperti yang kita tahu bahwa kita masih menghadapi berbagai permasalahan terkait dengan apa namanya kesehatan anak dan remaja ya, bahwa untuk remaja ini adalah fase yang sangat kritikal, yang sangat penting dalam siklus kehidupan manusia ya, sehingga ketika kita melakukan intervensi pada kesehatan anak dan remaja, ini akan sangat berkontribusi pada bagaimana nanti masa depan di Indonesia khususnya ya, untuk pembangunan dan pendidikan juga terkait dengan hal-hal yang terkait dengan ekonomi dan sosial. Nah, Bapak Ibu, kita juga tahu bahwa Indonesia ini juga kita punya target ya untuk bisa mencapai bagaimana nanti ada Indonesia emas di 2045, dan ini sangat ditentukan oleh kesehatan anak dan remaja yang sangat penting untuk bisa kita prioritaskan. Jika anak-anak Indonesia dan remajanya sehat, maka nanti untuk pendidikan dan prestasi belajarnya juga akan menjadi baik begitu ya, berkualitas. Dan kenapa kita penting untuk bisa fokus pada kesehatan anak dan remaja supaya nanti bisa menyiapkan orang-orang dewasa ya yang sehat dan juga produktif. Kemudian nanti generasi selanjutnya yang nanti dilahirkan oleh anak-anak dan remaja kita juga memiliki kualitas yang baik dan sehat gitu ya. Nah, Bapak Ibu dan kita tahu bahwa anak dan remaja juga di Indonesia ini jumlahnya sangat banyak ya, Bapak Ibu ya. Jadi uh, untuk remaja sampai saat ini hampir 45 juta usianya di Indonesia. Dan kita tahu bahwa anak-anak juga kalau dalam profil terkait dengan anak ini juga jumlahnya sangat banyak ya Bapak Ibu, sehingga ini penting untuk bisa kita prioritaskan. Jadi kalau anak di Indonesia berdasarkan profil anak 2024 ini ada 80 juta anak usia 0 sampai 17 tahun dan hampir 45 juta remaja berdasarkan BPS 2023, dan ini mengapa menjadi sangat penting untuk bisa prioritaskan terkait dengan kesehatan anak dan remaja. Nah, tetapi memang kita masih mengalami banyak persoalan ya begitu Bapak Ibu. Jadi terkait dengan di dalam berbagai survei, kebetulan UNICEF Indonesia dengan WHO Indonesia dan Kementerian Kesehatan baru saja melakukan pemetaan terkait dengan indikator-indikator kesehatan remaja yang telah ditetapkan secara global. Ada 47 indikator kesehatan remaja dalam Global Action of Measurement of Adolescent Health yang dilakukan di 3 negara, Brazil, kemudian Afrika, Indonesia. Indonesia baru saja di beberapa minggu lalu melakukan workshop dengan Kementerian Kesehatan, dan kita melihat memang untuk permasalahan remaja khususnya ini masih banyak terjadi di Indonesia, terutama yang terkait dengan kesehatan reproduksi, kesehatan mental, kemudian gizi, juga yang terkait dengan aktivitas fisik ya, dan juga yang terkait dengan kebersihan diri gitu ya, kebersihan diri. Nah, dari berbagai data kita melihat teman-teman semua, Bapak Ibu, bahwa di isu gizi kita masih menghadapi triple burden malnutrition untuk gizi ya Bapak Ibu. Jadi banyak anak-anak remaja kita yang obesitas gitu ya, kemudian yang kurus, kemudian yang juga mengalami anemia. Jadi kalau dari data yang kita lihat terkait dengan isu gizi, di sini kita bisa melihat bahwa satu dari 4 anak usia 13 sampai 15 tahun, berarti ini anak-anak SMP kita ya, dan 1 dari 8 anak usia 14 sampai 18 tahun mengalami overweight dan obesitas. Kemudian 1 dari 4 anak usia 5 sampai 14 tahun dan usia 15 sampai 24 tahun mengalami anemia ya, dan juga kalau kita melihat di isu personal hygiene atau kebersihan diri, ini kita bisa melihat bahwa ini banyak anak-anak kita yang belum melakukan praktik cuci tangan dengan benar. Jadi hanya 1 dari 2 anak usia 10 sampai 19 tahun yang melakukan cuci tangan dengan benar. Ini dari sisi kebersihan diri. Untuk physical activity misalnya, Bapak Ibu dan teman-teman semua, bahwa ternyata 7 dari 8 peserta didik ya usia 15 sampai 17 tahun ini tidak aktif secara fisik minimal 60 menit per hari. Nah, ini ada data-data ini ditunjukkan baik dari SKI, dari Survei Kesehatan Indonesia, kemudian dari GSHS atau Global School Health Survey yang sudah dilakukan oleh BRIN dan WHO. Kemudian juga yang terkait dengan risky behavior, artinya perilaku yang terkait dengan merokok misalnya ya, bahwa 1 dari 4 anak usia 15 sampai 19 tahun ini sudah merokok, dan yang kita tahu bahwa banyak juga masalah-masalah yang terkait dengan mental health atau kesehatan remaja. Jadi kalau kita lihat di sini 1 dari 50 individu ya berusia 15 sampai 24 tahun ini juga mengalami depresi ya. Jadi banyak kita temukan juga di dalam berbagai media. Akhir-akhir ini banyak juga remaja yang melakukan bunuh diri, mengalami kecemasan dan lain sebagainya. Dan ini merupakan masalah kesehatan mental yang dihadapi oleh banyak remaja saat ini. Dan yang terakhir adalah masalah kesehatan yang berhubungan dengan kesehatan reproduksi kalau di sini ya Bapak Ibu, teman-teman semua. Jadi yang terkait dengan perkawinan anak, kemudian pemahaman tentang resiko-resiko kesehatan reproduksi yang kemudian ini bisa berujung pada perilaku perilaku seksual yang tidak sehat dan bertanggung jawab. Kemudian teman-teman semua dan Bapak Ibu, nah sebetulnya kalau di Indonesia ini sudah cukup banyak terkait dengan kebijakan ya, terkait dengan kebijakan dan program yang berfokus pada kesehatan anak dan remaja. Kita tahu saat ini kalau teman-teman mengikuti berbagai program prioritas dari pemerintah Indonesia. Dari pemerintah Indonesia, kita ada kegiatan atau program yang berhubungan dengan kesehatan sekolah misalnya ya. Kemudian juga cek kesehatan gratis sekolah, makan bergizi gratis, yang semuanya menyasar usia anak dan remaja ya untuk meningkatkan status kesehatan mereka. Nah, saat ini saya dengan teman-teman Kementerian Kesehatan juga sedang merevisi pedoman kesehatan sekolah yang merupakan turunan dari Undang-Undang Kesehatan tahun 2023, juga diturunkan dalam Peraturan Pemerintah Nomor 28 Tahun 2024 terkait dengan kesehatan. Di situ ada pasal khusus terkait dengan kesehatan remaja dan kesehatan sekolah, bahwa anak dan remaja menjadi fokus dalam kesehatan yang harus dilakukan melalui berbagai upaya promotif, preventif, kuratif, rehabilitatif, dan dilakukan dipimpin oleh sektor pendidikan bersama dengan sektor kesehatan. Artinya selama ini yang mungkin banyak yang berpikir bahwa urusan kesehatan anak dan remaja ini adalah urusan sektor kesehatan. Ini sudah di state, di mention di dalam kebijakan kita, di dalam undang-undang dan peraturan pemerintah kita, bahwa kesehatan sekolah misalnya itu dipimpin oleh sektor pendidikan berkolaborasi dengan sektor kesehatan, termasuk dengan Kementerian Agama yang memang membawahi peserta didik di madrasah ataupun pesantren. Jadi ketika kita melihat policy ini, Bapak Ibu dan teman-teman semua, kita perlu bersyukur bahwa Indonesia punya kebijakan yang sangat kuat terkait dengan kesehatan anak dan remaja. Kalau teman-teman mengikuti program prioritas kita, Cek Kesehatan Gratis Sekolah, ini sudah di-launching sejak 4 Agustus ya, yang sebetulnya merupakan pemeriksaan kesehatan di sekolah yang sudah dilakukan sejak lama, tetapi kemudian di-rebranding namanya dengan Cek Kesehatan Gratis Sekolah. Ini sudah melibatkan berbagai sektor, termasuk Kemendikbudrismen, Kemenak, Kemendagri, Kemensos dengan keputusan menteri dan surat edaran untuk memastikan bahwa masing-masing pihak ini berperan untuk bisa mengatasi masalah kesehatan anak dan remaja dengan melakukan pemeriksaan kesehatan di sekolah. Ini akan menjadi upaya untuk bisa mendeteksi penyakit lebih dini. Kemudian juga dalam pelaksanaannya, nanti saya bisa share ke teman-teman dan Bapak Ibu semua, sudah juga menggunakan digital health ya untuk bisa melakukan pencatatan, pelaporan, men-tracking peserta didik juga nanti ke depannya untuk memberikan report kesehatan yang sudah dilakukan pemeriksaannya di sekolah. Jadi ini adalah beberapa policy yang sudah ada di Indonesia terkait dengan kesehatan anak dan remaja. Dan kita bersyukur bahwa masing-masing kementerian juga telah menerbitkan ya kebijakan yang terkait dengan topik-topik tertentu. Misalnya terkait dengan pencegahan kekerasan atau perundungan, begitu ya. Kemudian juga kawasan tanpa rokok termasuk di sekolah. Kemudian juga yang terkait dengan tadi ya pemeriksaan kesehatan yang rutin dilakukan setiap tahun di sekolah maupun di luar sekolah, sehingga kita punya dasar yang kuat untuk melakukan implementasi program termasuk inovasi dalam menggunakan digital health literacy atau platform-platform online yang dikembangkan baik oleh kementerian maupun oleh mitra pembangunan dan mitra lainnya yang bergerak di isu kesehatan anak dan remaja. Ini kalau kita lihat kerangkanya, Bapak Ibu dan teman-teman semua, untuk upaya kesehatan remaja, ya kita tahu bahwa memang ada irisan antara usia anak dan remaja. Kita bisa melihat kerangkanya seperti ini, teman-teman dan Bapak Ibu semua, dan di dalam kerangka kerja ini kita sangat bisa melakukan pendekatannya melalui inovasi-inovasi digital gitu ya. Nanti saya bisa menyampaikan kepada teman-teman dan Bapak Ibu semua beberapa platform yang sudah digunakan untuk kesehatan anak dan remaja. Bahwa kita perlu melakukan berbagai upaya, baik promotif, preventif, kuratif, rehabilitatif, dan paliatif untuk kesehatan anak dan remaja. Untuk kesehatan remaja, kita tahu bahwa ada isu-isu penting terkait dengan gizi, terkait dengan perilaku beresiko, terkait dengan kesehatan mental, begitu ya, dan terkait dengan kesehatan reproduksi, yang itu perlu dipromosikan baik oleh tenaga kesehatan maupun kalau di sekolah berarti pendidik, tenaga kependidikan juga bisa memberdayakan kader kesehatan sekolah ataupun luar sekolah terkait dengan isu-isu gizi, ya, kemudian juga gaya hidup sehat, kemudian perkembangan remaja harus seperti apa, termasuk bagaimana kita mendorong untuk pendidikan keterampilan hidup sehat melalui usaha kesehatan sekolah dan platform lain di luar sekolah yang biasanya mungkin kalau teman-teman dan Bapak Ibu pernah mendengar untuk pendekatan melalui PKPR begitu ya, pelayanan kesehatan peduli remaja atau PIK remaja dan lain sebagainya yang mengusung isu-isu ini. Juga terkait dengan reproductive health dan layanan terhadap kesehatan yang bisa diakses yang ramah bisa diakses oleh remaja tanpa diskriminasi ya dan tanpa ada apa namanya menghakimi untuk siapapun remaja yang datang ke layanan. Nah, untuk upaya preventif ini dilakukan baik di satuan pendidikan maupun di luar satuan pendidikan, hal-hal yang sifatnya terkait dengan imunisasi. Saat ini misalnya yang sedang kita kampanyekan, gencar kita kampanyekan adalah untuk awareness raising dan implementasi imunisasi HPV untuk remaja putri ya dalam pencegahan kanker serviks. Kemudian juga preventif lainnya adalah health screening yang saat ini salah satu program prioritas pemerintah adalah cek kesehatan gratis sekolah. Ya, kemudian nutrition supplementation tadi dari moderator menyampaikan apa namanya ada salah satu program yang sudah beberapa tahun terakhir dilaksanakan untuk remaja adalah aksi bergizi yang merupakan rangkaian kegiatan termasuk di dalamnya untuk mengkonsumsi tablet tambah darah bersama-sama ya di sekolah seminggu sekali sepanjang tahun dan ini dilakukan bersamaan dengan aktivitas fisik, dengan pendidikan gizi, dengan sarapan bersama yang kemudian dijadikan satu gerakan dan perlu dilakukan oleh seluruh satuan pendidikan khususnya di jenjang SMP dan SMA sederajat. Juga untuk kegiatan-kegiatan preventif lainnya. Nah, untuk kuratif ini tentunya berhubungan dengan manajemen kasus dan rujukan sesuai dengan temuan penyakit yang didapatkan. Kemudian upaya-upaya rehabilitatif ini khususnya untuk apa namanya untuk penyakit kronis dan eh, pelayanan jangka panjang ya, pengobatan jangka panjang termasuk juga untuk kondisi-kondisi yang jarang ditemui dan yang terakhir adalah paliatif. Bagaimana kita meningkatkan kualitas kesehatan anak dan remaja ya untuk bisa sembuh dari sebuah penyakit. Nah, kerangka program ini teman-teman Bapak dan Bapak Ibu semua ini sudah ada di dalam kebijakan kita dan terus berproses untuk diimplementasikan melalui berbagai program yang ada di kementerian lembaga. Selain policy, karena kemarin kita juga baru saja melakukan workshop terkait Global Action for Measurement of Adolescent Health di Indonesia, kita sangat bersyukur bahwa Indonesia ini sudah punya banyak sekali program terkait dengan kesehatan anak dan remaja gitu ya. Bahkan ini diampu oleh berbagai kementerian dan lembaga, terutama isu-isu yang terkait dengan gizi, isu-isu yang terkait dengan kesehatan reproduksi, kesehatan mental. Walaupun kemarin kita juga sempat memetakan bahwa ada beberapa hal yang masih menjadi gap, misalnya yang terkait dengan cedera begitu ya, karena ternyata penyebab kematian yang cukup tinggi terjadi pada kelompok usia remaja justru adalah yang berhubungan dengan injury gitu. Nah, ini adalah kerangka program untuk kesehatan remaja. Sementara untuk spesifik terkait dengan kesehatan sekolah yang juga sudah diatur dalam kebijakan kita dalam Undang-Undang Kesehatan dan Peraturan Pemerintah terkait dengan kesehatan. Kalau Bapak Ibu dan teman-teman sudah sangat familiar dengan usaha kesehatan sekolah yang sudah puluhan tahun ada di Indonesia begitu ya dan saat ini sedang dioptimalkan kembali untuk bisa mendukung program-program prioritas pemerintah Indonesia termasuk CKG dan MBG. Kerangkanya seperti ini, Bapak Ibu dan teman-teman, dan ini tentu juga mengacu pada benchmarknya WHO untuk Health Promotion School bahwa kesehatan sekolah ini menjadi upaya untuk bisa memastikan status kesehatan anak usia sekolah dan remaja melalui komponen pendidikan kesehatan, pelayanan kesehatan, pembinaan lingkungan sekolah sehat yang tidak bisa tidak bisa berjalan baik tanpa didukung oleh tata kelola kesehatan yang baik. Jadi Ini yang kita upayakan, sedang berproses kami dengan Kemenkes, Kemendikbud, Kemenak untuk bisa memastikan bahwa pendidikan kesehatan ini terintegrasi ke dalam kurikulum secara baik secara kokurikuler, intrakurikuler, dan ekstrakurikuler, dan juga melalui pembiasaan budaya hidup sehat. Nah, kemudian untuk health services, untuk layanan kesehatan, sama dengan kerangka program yang sebelumnya sudah disampaikan dalam slide sebelumnya, ini meliputi promotif, preventif, kuratif, rehabilitatif. Tentu hal-hal yang terkait dengan preventif ini akan sangat disesuaikan dengan usia dan jenjang pendidikannya. Misalnya untuk di PAUD ini ada pemberian vitamin A begitu ya, tetapi tidak untuk SMP SMA. Jadi SMP SD misalnya dia ada pemberian untuk eh, obat cacing begitu ya, tetapi tidak untuk SMP SMA. Sementara SMP SMA untuk apa suplementasi ini ada tablet tambah darah, tetapi tidak untuk yang jenjang bawah. Jadi ini sangat disesuaikan. Kemudian hal-hal yang terkait dengan kuratif, rehabilitatif, kita mengenal ada pertolongan pertama pada penyakit, pada kecelakaan, dan yang sekarang sedang dilakukan juga pertolongan pertama pada luka psikologis, begitu ya, sebagai bagian dari promosi kesehatan mental. Nah, kemudian untuk school health environment, teman-teman dan Bapak Ibu semua, bahwa selama ini kita berpikir bahwa masalah kesehatan anak dan remaja ini diakibatkan oleh lingkungan fisik yang tidak memadai atau tidak kondusif. Padahal sebetulnya lingkungan juga terkait dengan lingkungan sosial dan emosional, di mana lingkungan anak dan remaja itu harus terbebas dari kekerasan, dari perundungan, gitu ya, dari hal-hal yang bisa mendukung kesehatan mentalnya anak dan remaja. Nah, untuk school health governance dalam kerangka school health program, kita bisa melihat bahwa uh, sekolah ini perlu melakukan self assessment untuk bisa mengetahui ada di strata di strata manakah gitu ya sekolah tersebut ada. Jadi kita mengenal di Indonesia ini ada strata minimal, standar, optimal, paripurna, sehingga hasil dari self assessment nantinya bisa dijadikan dasar untuk melakukan perencanaan terkait dengan kesehatan sekolah, melakukan kegiatan-kegiatan prioritas supaya nanti bisa dikoordinasikan dengan tim pembina dan tim pelaksana UKS di satuan pendidikan. Kemudian ada koordinasi, kemudian ada capacity building and monitoring evaluation. Jadi Bapak Ibu dan teman-teman semua, ini adalah kerangka untuk kesehatan sekolah yang pada pelaksanaannya baik di pusat, di daerah maupun di satuan pendidikan ini sudah melakukan berbagai pendekatan atau inovasi dengan menggunakan apa namanya berbagai pendekatan atau platform online begitu ya, terutama untuk health education, kemudian juga yang terkait dengan self assessment. Misalnya saat ini Kementerian Kesehatan dengan promosi kesehatan, Direktorat Promosi Kesehatan sedang mengembangkan microsite untuk sekolah bisa melakukan self assessment menggunakan platform online gitu, sehingga pencatatan pelaporan nanti akan lebih mudah, juga untuk men-tracking gitu ya di strata yang manakah sekolah tersebut berada. Nah, ini adalah adolescent health intervention ya, termasuk anak sebetulnya. Kalau kita melihat model ekologi, bahwa pendekatannya akan tidak bisa hanya menyasar pada individu anak dan remajanya saja, begitu. Jadi tetap harus bisa menyasar komunitas dan interpersonal, pihak-pihak yang sangat dekat dengan anak dan remaja. Itu biasanya ada tiga, ada orang tua, ada guru jika di sekolah, dan ada teman sebaya. Jadi pendekatan yang dilakukan tentu perlu menyasar lapisan yang paling dekat dengan anak dan remaja. Kemudian ada organisasional, termasuk di sini adalah sekolah misalnya ya. Kemudian ada structural and environmental. Ini termasuk policy policy maker misalnya untuk memastikan bahwa kebijakan dan program yang dibuat ini betul-betul sesuai dengan situasi dan kebutuhan anak dan remaja. Ada prinsip-prinsip yang harus diterapkan begitu terkait dengan kesehatan, intervensi kesehatan anak dan remaja. Tentu kita tidak bisa membeda-bedakan, siapapun berhak untuk mendapatkan informasi dan layanan kesehatan anak-anak dan remaja di satuan pendidikan, di luar satuan pendidikan, remaja yang rentan gitu ya, yang beresiko, semua perlu mendapatkan haknya. Kemudian juga mempertimbangkan kesetaraan gender ya, kemudian kerahasiaan, privacy and confidentiality ini penting. Termasuk misalnya hasil-hasil dari pemeriksaan kesehatan anak perlu kita jaga kerahasiaannya. Oleh karena itu penting untuk kita memberikan concern begitu ya, persetujuan terkait dengan health services ini. Kemudian juga memastikan layanan ini
Pardon me,
ramah remaja.
I'm sorry.
Ya,
Sorry for reminding you to complete this presentation at 10:15. Do you mind?
yes, oke. Terima kasih Ibu Lina Uli. Selanjutnya, nah ini Digital Health Intervention for Child and Adolescent. Jadi teman-teman dan Bapak Ibu semua bahwa dalam implementasi program kesehatan anak dan remaja, Indonesia sudah banyak melakukan pendekatan untuk digital health literacy. Kemudian untuk praktek online counseling di beberapa mitra begitu ya, organisasi juga sudah menerapkan online counseling khususnya untuk isu-isu yang berhubungan dengan misalnya kesehatan reproduksi, kemudian pencegahan kekerasan, dan juga yang terkait dengan kesehatan mental. Kemudian juga behavior change, nanti saya bisa share mungkin 1-2 video begitu ya terkait dengan behavior change untuk kesehatan anak dan remaja, tracking dan monitoring untuk kesehatan anak dan remaja, kemudian digital health services dan digital campaigns and communication. Ini yang kemudian menjadi inovasi yang dilakukan untuk memastikan tidak hanya peningkatan pengetahuan pada anak dan remaja, tetapi juga akses pada layanan dan perubahan sikap dan perilaku yang diharapkan. Nah, untuk health education on digital platform, jadi ini adalah platform rumah pendidikan dan juga bisa diakses di website Ayo Sehatnya Kemenkes untuk berbagai sumber informasi terkait dengan health education yang bisa dibaca oleh siapapun, termasuk oleh peserta didik di berbagai jenjang. Kemudian juga untuk petugas kesehatan dan lain sebagainya untuk guru. Dan ini sudah menggunakan platform online gitu ya untuk bisa diakses di Ayo Sehat. Kemudian ini adalah terkait dengan cek kesehatan gratis sekolah. Jadi platform online ini nanti teman-teman dan Bapak Ibu semua juga bisa mengakses bagaimana cek kesehatan gratis di sekolah. Ini sudah terintegrasi dengan Satu Sehat Indonesiaku, di mana nanti peserta didik nanti bisa dibantu oleh guru atau orang tua bisa melakukan pendaftaran, kemudian nakes juga bisa melakukan pencatatan pelaporan, juga bisa melihat hasilnya di dalam Satu Sehat Indonesiaku. Tetapi disclaimer, ini sedang dalam proses begitu ya, hanya untuk tutorialnya sudah cukup lengkap, sudah dikembangkan oleh teman-teman Kementerian Kesehatan. Digital platform untuk free medical check-up in school, ada pencatatan layanan CKG sekolah, bagaimana mengirim rapor kesehatan, kemudian bagaimana screening mandiri peserta CKG sekolah dilakukan, pendaftarannya seperti apa, dan ini nanti teman-teman dan Bapak Ibu semua bisa mengaksesnya di YouTube di Kementerian Kesehatan. Nah, ini adalah contoh lain digital platform for adolescent nutrition. Kalau teman-teman dan Bapak Ibu pernah mendengar ada aplikasi Ceria yang juga sudah dikembangkan oleh di dalam website dengan dukungan UNICEF. Ini adalah program yang didesain untuk mencegah anemia pada remaja. Namanya aplikasi Ceria. Saat ini bisa digunakan juga melalui website. Dan ini adalah untuk memonitor, untuk tracking pengguna konsumsi tablet tambah darah seminggu sekali oleh remaja di Indonesia. Juga awareness untuk pentingnya perilaku makan sehat begitu ya. Jadi ini nanti saya bisa bisa play di akhir presentasi. Terakhir, ini adalah contoh lain dari digital platform untuk menstrual health and hygiene management. UNICEF Indonesia telah mengembangkan aplikasi OKI namanya, yang bisa dijadikan selain untuk health education untuk sexual reproductive health dan menstrual health and hygiene, ini juga merupakan inovasi yang didesain untuk remaja perempuan, juga sebetulnya laki-laki, guru, orang tua bisa tetap mengakses aplikasi ini untuk melakukan tracking begitu ya untuk periode menstruasi. Kemudian di dalamnya juga ada ensiklopedia terkait dengan kesehatan reproduksi, menstruasi, pubertas, relationship, kemudian bodily changes, kemudian juga yang terkait dengan mitos dan fakta, gaya hidup dan lain sebagainya. Semua bisa diakses dalam satu aplikasi namanya OKI. Jadi kami di UNICEF juga sudah melakukan final study bahwa banyak remaja perempuan yang meningkat pengetahuannya karena bisa mengakses menggunakan OKI aplikasi ini, kemudian juga diingatkan tentang periode menstruasinya, diingatkan tentang kesehatan menstruasinya, sehingga praktik untuk menjaga kesehatan dan kebersihan menstruasi ini menjadi lebih baik. Nah, ini terakhir rekomendasi untuk bagaimana kita memanfaatkan digital health begitu ya untuk kesehatan anak dan remaja. Tentu ini harus didukung oleh policy and regulation. Jadi sudah masuk sebetulnya di dalam undang-undang dan peraturan pemerintah kita terkait dengan kesehatan remaja dan kesehatan sekolah. Saat ini akan dimasukkan juga, sedang difinalisasi untuk pedoman kesehatan sekolah yang nanti akan ditandatangani oleh Kemendikbudristek, Kemenak, Kemenkes, dan masing-masing direktorat juga sedang mengembangkan juknis yang spesifik untuk kebutuhan setiap jenjang. Kemudian kalau tadi kita melihat berbagai contoh yang sangat spesifik isu terkait adolescent health, kita juga salah satu rekomendasi lain adalah perlu develop integrated digital health platform. Jadi nanti isu-isu kesehatan lainnya bisa dilihat di satu platform tersebut. Yang existing platform sekarang adalah misalnya website UKS yang diampu oleh Kemendikbudristek saat ini sedang direvitalisasi ya teman-teman dan Bapak Ibu semua, terutama untuk mendukung program-program pemerintah Indonesia. Kemudian juga memastikan digital inclusion bahwa ini bisa diakses oleh seluruh anak dan remaja. Dan yang penting adalah bagaimana meaningful youth participation dalam develop digital health platform ini betul-betul melibatkan remaja, mulai dari mendesain, melaksanakan, sampai mengevaluasinya. Dan kita juga perlu tahu dari berbagai platform yang sudah dikembangkan untuk digital health ini, dampaknya seperti apa. Sehingga studi-studi untuk research dan monitoringnya ini perlu selalu di-update, dikembangkan. Nah, mungkin itu Ibu moderator for my presentation. Silakan nanti kita mungkin bisa diskusi atau ada hal yang kurang jelas. Namun sebelum saya tutup, mungkin saya bisa share dulu video singkat terkait dengan contoh digital health untuk sexual reproductive health, terutama fokus pada MHM, Menstrual Health and Hygiene Management, untuk melalui aplikasi OKI untuk remaja perempuan.
Well, Ibu Yayu, please. Boleh Bu, disilakan.
Oke.
Aplikasi pelacak menstruasimu. Nama saya Selamat datang di Oki, aplikasi pelacak menstruasimu. Nama saya Ari. Gunakan Oki untuk mengenal dirimu dengan melacak apa yang terjadi pada tubuh dan moodmu setiap bulan dan belajar tentang menstruasi secara menyenangkan. Buat akun, kemudian pilih teman Oki seperti saya untuk menemanimu. Kami di sini untukmu setiap saat. Ini adalah siklus mens kamu. Setiap bentuk adalah sebuah tanggal di bulan. Angka ini adalah waktu hitung mundurmu yang menunjukkan sisa hari sebelum mens atau berapa sisa hari mens kamu bulan ini. Lacak mood, alur mens, tubuh, dan aktivitas dengan emoji pada catatan harian. Menulis di buku harianmu. Tes pengetahuanmu dengan ikutan kuis. Cek kalender untuk melihat perkiraan satu bulanmu. Dan cek informasi soal menstruasi dan pubertas di Oki untuk belajar hal baru tentang tubuh dan kesehatanmu. Serta jangan lupa untuk memberikan kami cinta. Selamat datang di Oki teman, untuk remaja perempuan dari remaja perempuan.
Okay, thank you Ibu Moderator for the time, and please if there is question or maybe someone want to give additional information related to the digital health and everything about adolescent children and adolescent health, please.
Well, thank you, Ibu Yayu Mukaroma. I'm sure that many participants are courageous to discuss many things with Ibu Yayu, but because of the limited time and durations, I do apologize, Ibu. We cannot open the Q&A session, but would you mind to share the answers of the participants' questions later by email or anything, any applications, please?
Yes, of course, Ibu.
All right, thank you, Ibu Yayu, for your insightful presentation and for any elaborations. We truly appreciate your time and valuable contribution to the session. Now, before we close, we would like to take a group photo together with our speaker, Ibu Yayu Mukaroma, and all participants. May I kindly invite everyone to turn on, please, your camera because we want to take this photo together. Okay, I will count on and then smile. Let me count, please. 3, 2, 1. Once again. 3, 2, 1. Well, thank you, Ibu Yayu Mukarohma, SOS MKM, for the wonderful session. I do apologize for the limited durations, Ibu Yayu. I hope we will have discussion further to the next session. Well, Ibu Yayu, you may leave this Zoom meeting if you would like to do any other activities. We hope we could see you in another chance and discussion. Well, Bapak Ibu, ladies and gentlemen, in this last session of today's agenda, we are now moving forward to our experiencing third speaker. I do apologize if I'm mistaken to pronounce the name. Miss Kwangko Wong Cherian, PhD, MSN, RN, who will talk about health education and innovation. But first thing first, let me show you our speaker's curriculum vitae. All right. It is my great pleasure to introduce our next esteemed speaker, Ms. Kwangko Wong Cherian, PhD, MSN, RN. Dr. Wong Cherian, accomplished nurse educator and researcher from Naresuan University, Thailand. She serves a faculty member in the Department of Adult and Gerontological Nursing, where she also leads the Adult Nursing Division and contributes to both curriculum development and international relations with the faculty. Dr. Wong Cherian holds a PhD in nursing from the University of Washington, USA, specializing in biobehavioral nursing and health informatics. Her doctoral research made significant contributions to the development and validation of prognostic models for traumatic brain injury, particularly for improving clinical decision-making in research-limited settings. Dr. Wang Cherian has more than 15 years experience in adult and critical care nursing, with academic and research interests that include traumatic brain injury, prognostic modeling, simulation-based education, digital health innovation, and patient safety. She has published extensively in both national and international journals and has presented her work at global conferences. Her recent publications address topics such as outcome prediction in traumatic brain injury, treatment satisfaction in chronic illness, and the long-term impact of COVID-19. In addition to her teachings and research roles, Dr. Wang Charin actively serves the scientific community as an invited reviewer for leading journals, including Neurocritical Care and Clinical Nursing Research. She also a proud member of the Sigma Tau International Honors Society of Nursing. Driven by her passion for advancing nursing education, technology integration, and global collaboration, Dr. Wang Charin continues to inspire the next generation of nursing professionals to deliver compassionate, evidence-based care. Please join me in welcoming Dr. Konka Wang Cherian. Miss Konka Wang Cherian, the screen is yours now. Thank you.
Thank you so much, Miss Moderator. Thank you for your kind introduction. Can you hear me well? Can you hear me well?
Yes, you can hear to your voice very well.
All right, thank you so much. So, I'm on the way to another trauma conference in Thailand, so I probably cannot bring up the visual, but hopefully the audio communication right now is okay with all of you.
Yes,
Can you
it's
hear me
very
well?
okay. Yes, it's very okay, Miss. Thank you.
All right, great. So, I already asked one of your staff to show my presentation, and I might need your help to put down for each slide. Okay, great. Thank you very much. Well, thank you, the chairman and the conference committee for giving me the chance to collaborate as a speaker for this conference. It is truly an honor. And good morning, everyone. I'm Dr. Kwan Wongtaran from the Faculty of Nursing, Naresuan University in Thailand. Today, I share my journey of how clinical nurse challenges inspired innovation through two of the projects that I have been working on during the last 5 years. It's the pupil screen and the NU smart wearable sensor. And these projects illustrate how health education and innovation can merge to create meaningful and real-world impact. So this is an overview of my presentation. I will begin by exploring how nursing innovation has evolved in the past COVID era. And then I highlight two case studies, the pupil screen, which is a mobile neural assessment app, and the NU smart wearable sensor, which is a student-driven innovation for pressure injury prevention. And then finally, I'll discuss how these experiences shape educational integration and future directions. Next slide, please. So health education is no longer just about transferring knowledge. It's about empowering nurses as innovators who transform bedside problems into solutions. And the COVID-19 pandemic accelerated digital health and wearable technology. So nurses were on the front line, identifying unmet needs and creating scalable and practical innovations often with limited resources. And my journey in nursing innovation began with the pupil screen project, which inspired a new generation of undergrad students to develop the NU smart wearable sensors for pressure injury prevention. Next slide, please. Let's start with the pupil screen project. Traumatic brain injury, or we call it TBI in short, is a global challenge. Each year, about 17 per 100,000 people in the US and China experience TBI. But in Thailand, the rate is twice as high. It's 36 per 100,000 population, which mainly due to traffic accidents and limited pre-hospital care. And that reality motivated us to seek better and faster assessment tools. Next slide, please. And traditionally, we rely on a pen light to observe the pupil light reflex. However, this method is highly subjective. The results are very depending on the clinician skill and lighting conditions. So we asked, why can we make this process more objective and quantifiable? Next, please. So we came up with this idea to making the app on the mobile phone. Basically, we call this app pupil screen. The pupil screen uses smartphone camera and flash to objectively measure the pupil light reflex, which is a key indicator of brain injury severity. Next one, please. So the pupil screen uses machine learning algorithms to quantify pupil constriction and dilation. And then it's measure changes which is beyond human perception. I also giving you the reference of the paper that we published in 2017. This is the preliminary studies that we measure the ability of our phone app, the pupil screen, in order to detect the changes in pupil light reflex. Next slide, please. The results of the study show that the performance of the app achieves precision beyond human perception with the median diameter error of 0.36 millimeters compared to the human limit of 0.5 millimeters. The app transforms mobile technology into a diagnostic tool and bridging the gap between resource-rich and low-resource healthcare settings. And as you can see, there is a lot of graph and figure on this slide. We originally measuring the performance of this app among people in the US, which including people with blue eyes, brown eyes, and mixed color of eyes, so for example, green eyes. And we found that if you can see the lower part of the slide that have the three figures, these are scatter plots. And basically, the scatter plot show that if all the dots are grouping together, it means that the error rate is not that much, which is good. But if the plots are very scattered, that means the errors are big. So if you can see that in the middle of the middle figure, so the scatter plot error of people with brown eyes, it seems that with one who have the darker eye colors, the error rate by using this app is getting higher because of the when you have the darker eyes, the reflection on the your eyes when it's reflecting on the light is much higher than the other colors of the eyes, and these give the error for this app. And this leading to the researcher group to bring the project to study in Thailand, because in Thailand we have much more proportion of people who have darker eyes. Next slide, please. So essentially, it's with this pupil screen, it turns an everyday phone into a portable neural assessment device. which is ideal for low resource setting. And this is the final interface of the pupil screen. There is a video clip showing how it's used on YouTube, and I also put the link here in case you want to look into it after this presentation. Next slide, please. So this innovation was a multidisciplinary effort. It included nurses, engineers, computer scientists, and physicians. And my role as a clinical researcher connected patient needs with technological design. It was a truly global collaboration that reshaped how I view nursing research. Next slide, please. And what did I learn from that project? I learned that innovation emerges when nurses' clinical insights meet technological expertise. And I think innovation isn't born in a lab. It begins at the patient's bedside by incorporate empathy, scientific rigor, and creativity. All of them together has formed the foundation of nursing innovation. And this experience inspired me to bring innovation thinking into the classroom. Next slide, please. So after pupil screen, I wanted my students to experience this same sense of creative discovery. So we integrated design thinking into nursing education and teaching students to empathize with patients, define problems, ideated solutions, build prototypes, and test them. This approach gave rise to the Endure Smart Wearable Sensor project. Next slide, please. Let me give you some more background about this project. So we are talking about the pressure injuries. Pressure injuries remain a persistent issue, especially among immobilized and critically ill patients. In Thailand, the incidence is about 10 to 11%. And conventional prevention methods like air mattress or frequent repositioning are effective, but they are also expensive and very labor intensive. So students recognize this as a clinical problem that's worth solving. Next slide, please. So the project adopted design thinking as a framework for student learning. It emphasized empathy, ideation, prototyping, and testing. Students applied critical reasoning, evidence review, and teamwork skills in developing their innovation. Next slide, please. That solution was wearable pressure sensing device that detected early screen compression. The sensor alerts caregivers when repositioning is needed to prevent tissue damage. It's simple, low cost, and adaptable for community hospital. If you can look at the sensor, actually the sensor is a plastic strip, the white one. It's very flexible and it's water resistant. So normally this sensor has been used in the pressure map that's used in the commercial industry in a very big factory where they want to measure the pressure load. And then we kind of found this one and working with the people at the School of Engineering, at School of Nursing to develop this sensor and adapt it to use in the clinical area. Right now, we are at the very beginning phase of making this prototype. So if you can see that, can you go back to the slide number 15? Yes, thank you very much. So the picture on your left hand is the very beginning phase of our sensor prototype. So we creating this electrical board there and then connecting the sensor and putting it to the battery over there. So basically, this sensor doesn't need to use any electrical resource like battery, but in order to transform the signal. So let me give you some more background on this sensor. So basically, this sensor can, once it's receiving pressure and in electrical field, this pressure kind of can be transformed into resistance. And then we using the computer algorithm to transform the value of that resistance into pressure. And then we sending the information about those pressure into computer and transfer it into the numeric value so that we can interpret it. So then we kind of improving the sensor to be more practical by adding wide and then trying to develop another prototype so that it can send information wirelessly. And that is much more practical in the clinical use. Next slide, please. So in order to do the initial study, we conducted a quasi-experimental, it's one group, pre-post-test design, along with descriptive evaluation. The participants included health volunteers and registered nurses. We measured three variables. One is accuracy of pressure detection. The second is user satisfaction. And the last is the feasibility in real world care. Next slide, please. And the results of the study were very promising. The prototype accurately detected different screen pressure levels, especially at the sacrum compared with the thigh. The user satisfaction was high, averaging 4.5 out of the total of 5 score. Nurses rated the device as very practical, user-friendly, and valuable in daily care. And most importantly, it was developed entirely by undergrad nursing students. Next slide, please. With this project, it shows that when students engage in real-world innovation, they become creators, not just consumers of knowledge. They gain confidence, understand research methods deeply, and learn to collaborate with engineering and technology disciplines. I think innovation learning bridges theory, practice, and creativity for them. Next slide, please. So moving forward, right now with our project, currently we aim to embed innovation modules in all nursing curricula, expand wearable sensor research for patient safety, and support patients and student startups. Also, we have the research support office at the Naresuan University, where it has the whole team of the staff that help us with the register the patents for this innovation. Our vision is not to just make nurses as a health providers, but we want our students to be health innovators too. Next slide, please. So I often remind my students that innovation begins at the bedside and it's driven by curiosity and compassion. And every idea can grow from simple observation into impactful innovation. And our role as educators is to nurture that curiosity among our students and give them the tools to create meaningful change. Next one, please. Thank you. I would like to express my gratitude to the Faculty of Nursing at Norwegian University, the NU Smart Sensor team, the Pupil Screen Research team, and our research office for continued support. And thank you for allowing me to share this journey. In conclusion, I think next one, please. In conclusion, I think innovation in nursing is not a luxury. It's actually a necessity. And through projects like Pupil Screen and NU Smart Wearable Sensor, we are redefining what nurses can do. And let us continue to educate, empower, and inspire our students to lead the next wave of health innovation. Thank you very much. And I think there is some time left, and I will appreciate if you have questions or idea to discuss with me. Thank you.
Well, thank you, Dr. Wong Charian, PhD, MS, and RN. We are fulfilled with in-depth understanding through your extraordinary explanation. While we come to the Q&A session, all the participants, I have one question in the chat box. Let me read the questions for you,
Okay,
Miss.
thank you.
Okay. I have a question for Comfort about PPL screen, especially for NU Smart. In both the PPL screen and NU Smart wearable sensor projects, nurses work closely with engineers and data scientists. What were the biggest challenges in this collaboration, and how did you keep the nursing perspective at the center of innovation? This is for the first question, Ibu. Thank you.
Wow, that's really such a great question. Yes, I have this question all the time. Firstly, I think one of the most challenges is that with each discipline, we have our own language, that we need to find a way.
Baik, saya akan melanjut. Baik, kita masuk dalam
Yes. I
Pardon
think
me.
is there any other questions? I just heard that there are some of the delegates in this conference probably speaking something.
We still focus on the first question, Miss Kunkal. You can
Okay.
continue your explanation. Sorry.
All right. Thank you. It's okay. Totally okay. So I think one of the most challenges is to find a way to communicate to each discipline. For example, when nurses talk to the people in engineering field, it's totally the whole different language. We have to translate what we want to measure, how to measure into the communication that they can understand. We also find, other than communication between each discipline, we also find that it's very challenging if we work with the international team. For example, with the Pupil Screen team, where their base are in Seattle, and my team were in Thailand. The time difference is quite challenging because if you want to set up a meeting, it will be if it's not very early in the morning, it will be very late in the night. And also I think another thing is that finding the way to have the funding support, because presenting the research project to getting the funding support is another skill set. And normally we didn't teach that in nursing school. So you have to find a place to learn from some other group of people who can provide that skill to you. Yeah, so in conclusion, I think if I have to conclude this answer is that the challenge are first trying to find a way to communicate it between different disciplines. Second, if you work with the people from different area or region in the world, you have to have the project manager to help you with the scheduling, the meeting. Having the team meeting is one of the big factor that will help your project success. And lastly, you have to keep learning on the different skills that doesn't provide this in school of nursing. For example, how to presenting the research project in order to get funding support.
Well, great answer, Ibu. Yeah, I do stand with you. I really sure that the communication is the most important key in this in doing this project. Can we continue
Right.
to the next question, Miss Konko?
Yes.
I have the second question from Ibu Khalida
Mhm.
Zia Sibualamu. Dr. Konko, how did the design thinking approach in the NU Smart Wearable Sensor project help nursing students think more critically and creatively? And how can such innovation be sustained in nursing education? That's
Okay.
the second question. Yes, thank you.
Wow, that's a big question. I try to digest that into two things. How design thinking approach helping my student to be nurse innovators, and the second, how to make this idea of being the innovator sustain in the university environment. So the first part of the question, how the design thinking approach help my students. I have to tell you about the history of the Naresuan University a little bit. So we just having the new president, and our new president has an idea that we are not only to teaching the students, but we are shaping them into an innovator and entrepreneuring tips, which is we want them to have the commercial idea. So that's one, they invented something, they can sell that too. And making profit from the discipline that they are specialized. So the university have this common class that teaching the design thinking approach. So each of the school, they have to set up this class and then kind of like asking the student to incorporate the idea of their whole disciplinary, for example, nursing, and kind of thinking of how to make nursing be more proficient, not just making benefit, not just making money, but also giving some creating some innovation in order to provide for the client to use at home. Probably ultimately you can make some more money from that too. So within this class, student learning the design thinking framework. The design thinking framework is very neutral. You can apply it to other disciplines. So let me show you the slide. Can you put on the slide number 14, please?
Oh, yes, please, Miss.
Okay. So slide number 14 show the design thinking process. And also I have put some of the explanation on this slide too. with the design thinking framework, they have 5 processes, which is empathize. It's kind of doing the brainstorm of gathering information of what is the situation out there, what are the problems, and then moving on to the define phase. Thank you very much. Moving on to the define phase. This phase, the student have to define what is their research question, and how are they gonna measure or finding the answer for that question. And then moving on to the ideate stage, they kind of brainstorm the solutions. They have to do the review literature and seeing what is out there, the solution that they have. And then they brainstorm and working with their friends or people who specialize in helping them answer this question to create a prototype, which in this case, they build sensor prototype. And then they test it by doing the research clinical study. So as you can see, these 5 processes are very neutral, and you can adapt that into any area of the studies or discipline. But you have to find a way to put that in your nursing curriculum so that all of the students know this idea. And you also have to encourage the faculty in your school to kind of jump into this idea too and say that, all right, we all are going to help students to making something new, to making something that's not in any other textbook. And we are open to any idea from the students. And that's creating creativity. And also, it empowers students to think outside of the box. So moving on to the last part of this question. So you asked, how do we sustain this idea of helping and empowering our students to be the nurse innovator? So as I mentioned before, it has to come from the policy making level. In this case, it comes from the president, and then the dean of the School of Nursing adopt this idea, and every faculty have to jump into it and agree that okay, this is the direction that we are going to move on to, and then if you have all of the part of the people in your school having the same goal and sharing the same direction, then it helps keep sustainable. Also, you have to sell the product of this direction to other people too. Because if other people see this success and then they kind of giving you support and it's kind of a positive feedback to the people in your school to continue doing this thing. Right.
All right. Thank you, Dr. Glencoe. We hope we can implement this great idea in our classroom activity and in any other kind of disciplines as well. All right. I have the third question from Mr. Yarwin Yari. Yes, Mr. Yarwin, the screen is yours.
Thank you, Miss Lina, for your opportunity. And hello, Dr. Kwanke. Long
Hello.
time no see.
Yes.
Yes, I think the last we are seeing during my practicum in RS1.
Right. Is it in 2023?
Yes, that's right.
Yes, I remember you, Mr. Yavin.
Okay, thank you. But I will ask about your materi before, and I saw interest for your materi, and I know in Nerosan you have so many the robotic or the like a phantom in smart phantom, I think. So about your materi before about the smart apa sih?
Math sensor?
Yes, yeah, smart VR. So I think you are ready for application to your student, and how about your evaluation from your student after the use this your smart sensor? How about your evaluation? And then from your evaluation, you all student can use this smart sensor. And how about the experience after use this smart or after try this smart sensor? How about the experience your student and how about your the experience your student? This is the better from the other or what? How about you or from your evaluation? Because I know in narration you have so many phantom and the one or two phantom I already for trying. And uh, I will know about this smart sensor, mom. Thank you.
Thank you, Mr. Yamin. I just want to make sure that I understand all of the question that you asked. I think this is such a great question. So, you asked what are the experience of the student who making this and use smart sensor. What do they found in that study? Is that right? Can you hear me well?
Yes, you can,
Yes, yes,
Dr. Konko.
yes, hello. Yes.
Right. So if the question is, what did the student learn from using the pressure sensor, the NU smart sensor? I think first off, they learned that being a researcher is not that much pain, if you understand me. Because in most school, when we say that we want you to do some research, it's such a big headache. Students have to study research design and understand all of the background theory and dealing with data collection and data analysis. By doing this project, it's coming from that idea. So they already have the positive thought about doing this. No one forcing them to do it. And then during the whole process of collecting the data and analyzing the data, they learn from their own experience that this is what researchers do. That yes, there will be problems, but there also a way to figure that out too. And they work closely with me and the other faculties, and we act as their mentor, not their teacher. So as mentor, it means that we working alongside them, helping them um, finding the solution to solving the problem that they encounter. And then at the end, they also learn that yes, every project have the probably have some problem. For example, our first prototype of this sensor is not perfect. We find that if you can bring up the slide number 16. So on the slide number 16, it show you the figure of a mannequin laying on the supine position. So with this student project, their first aim of the study is to measure the accuracy of pressure detection. So basically, the sensor, if it's work, it has to show that if we put some pressure on that sensor, it has to show their pressure on. And if we put the sensor on the area that doesn't have the pressure to put on, then it's the sensor have to show that there is no pressure on this area. So we reviewed the literature and we found that the sacrum area or the coccyx are the area that's mostly receiving pressure in the supine position. So we put the sensor on the coccyx and the other one on the thigh because with the supine position, the thigh doesn't receive any pressure. So every time that we're measuring this, they have to show the significant difference between the pressure on the sacrum area and the thigh area. So theoretically, it should be perfectly having the data aligned that the coccyx area receiving a more intense amount of pressure. But considering anatomically difference in each person, we found that with the person who have the large buttock, when you put the sensor in the middle of the coccyx, the kind of the soft tissue of the buttock absorbing the pressure, so that the sensor did not work well with the people who have the anatomical structure like this. So we learn from that, and then we kind of using that as the data to develop another prototype. And that is what the student learn. They learn that by being the researcher, they have to keep continuing learning from the data and find a way to continually improving their research protocol. So I think that is the experience that my students have learned as the researcher.
All right.
Hopefully, thank you. Hopefully, I answer Mr. Yavin question. I think there are other parts of the question that he have asked, but I couldn't catch it. If you would kindly specify if there are other parts of the question that I haven't tapped on, I would be really appreciate that.
Okay. Thank you, Dr. Kwante Kapunkap.
You're very welcome.
Thank you, Dr. Kwanka, for the insightful explanation from your presentation. Well, guys, I have to close this Q&A session. Now we come to the closing. Thank you once again, Ms. Kwanka Wongcherin, PhD MS and RN, for answering all the questions. Now, before we come to the announcement of oral presentation, I would like to invite you to take a group photo together with Ms. Kwanka Wongcherin and turn your camera on, please. Well, Bapak Ibu, are you ready? Yes. So I will count on and please smile at the count 1. 3, 2, 1, and smile. Once again, let the committee capture this moment. 3, 2, 1, smile. Thank you. Thank you, everyone. Thank you once again, Dr. Kunko. Please give warm round and applause for Ms. Kunko Wongcherin, PhD, MSN, for the wonderful session. All right, Dr. Kunko, you may leave this Zoom meeting if you have the other activities.
All right, thank you very much. And if you have any further questions, please feel free to reach out to me at the email address that I give you at the presentation. Thank you. Goodbye.
Doctor, thank you. Goodbye.
Bye-bye.
All right, now we come to the next session. I will give the next session to our Master of Ceremony, Fitri Adela.
Okay, thank you so much, Miss Lina. As we approach the end of today's keynote sessions, allow me once again to thank all the speakers for their invaluable insights from various health fields like physiotherapy, public health, and nursing. Thank you for showing us how technology continues to transform the way we deliver care, promote health, and empower both professionals and patients. Your expertise and perspective have truly reminded us that while technology drives progress, it's the people behind it. That dedicated health professionals like all of you who make the real difference. And also thank you to all participants for your active engagement. Remember that this conference it's not only about listening but also about building relationships. So please take this opportunity to continue conversation even after the sessions. Okay, ladies and gentlemen, That concludes our morning session. We will take a break for prayer and lunch, and the event will start again at 1 p.m. for the oral presentation session. Thank you and have a pleasant lunch break.